I can think of an adult in their 40s, a male who came in after having their 7-year-old child diagnosed with ADHD, and in fact identified as his having these symptoms. He had sort of coped with them not all that well, was in a managerial position but not functioning optimally, had been passed over for promotions on numerous occasions, mainly because he didn't meet his deadlines.
I had to keep track of my time, I had to bill my clients, I had to run an office. It was all of those administrative tasks that were really a problem. At the same time, I thought I was setting a bad example for my son, and I was having some difficulty in my marriage, and so I sought some help. I found out about ADHD.
In discussing things with the patient and his wife, she described lots of instances around the home where he didn't listen to her, to-do lists just weren't completed, things weren't being done on the weekend, and she kind of felt that she was not only taking care of their 7-year-old son, but also taking care of the husband. So the diagnosis of ADHD became clear after a thorough evaluation, and in fact, this individual went on to treatment with a non-stimulant medicine and actually did quite well.
There have been so many benefits since I've been diagnosed with ADHD. I think I'm a better father. I'm certainly a better husband. My relationship with my wife is much more relaxed because we understand each other a lot better. We also understand that ADHD is not an excuse for what happens that goes along the way, but we understand where the behaviors come from so we can kind of work around them in the future. And I really think that a lot of adults would benefit from a diagnosis, and it's just one of the barriers, I think, to a lot of adults getting diagnosed is that there aren't more clinicians that are diagnosing adults with ADHD.